Hi everyone, and welcome to this video and to one of the very first episodes of Not Another Burnout. I am a psychotherapist. I have 7 years of clinical experience as a licensed mental health professional in Ontario, Canada, and I have 7+ more experience as a certified life coach. And this video is all about showing you the difference between life coaching and therapy. This field, both of these fields, are very dear to my heart, and I feel very much impelled to let you, as a consumer, know the difference between these two fields, okay? So, what I'm gonna do is I'm gonna erase this beautiful thing, Not Another Burnout. As a psychotherapist, after 7 years of practice, I have gotten a chance to work with a lot of healthcare professionals, and most of the times what we end up working on is their burnout and self-care practices and how that all transfers into their professional work. I have now pivoted my profession and pivoted my whole offering into helping health and wellness professionals to deal with all that and to heal themselves and to understand that their whole self and who they are comes through in their practice, and working within themselves and as that comes into their practice is so important because it reflects on the progress of their patients. So that's for another video. For this video, what we are going to focus and zone in on is the difference between coaching and therapy. I think that this is of an immense importance because there are so many coaches out there, and if you are in a social media target market for promotions and ads for coaches and therapists, it's very important for you to understand what it is that you're signing up for, okay? So pay attention, hone in, put everything away, take your notepads out or wherever you want to take your notes in and listen, all right? I'm gonna take my whiteboard, my trusty marker, because this is how I like to teach, and we're gonna go right in it. Okay, so imagine that you are, okay, think of yourself as a ship with sails on, looking for good weather so that you can sail on, okay? This is usually what people come into therapy or coaching or are looking for somebody to help them with getting better. They're looking for professionals to help them get better. And it is really, really hard sometimes all the time, to discern between who is it that I should employ, who is it that I should hire on to help me where I want to go, right? Or to help me deal with my troubles or my mental health issues or whatever it is that is happening to you, okay? So this is going to help you discern and help you decide who to hire, right? Okay. All right. So you're a ship, okay? Imagine yourself as a ship in the water. Beautiful water. Right now. You are a ship. Do we see that? We see that. All right. So imagine this. You are a ship standing in the water. You have your sails up, okay? Your sails are up. You're waiting for good weather. You're looking for the wind to blow. You're looking for good weather to sail forward. You want to move forward. What does the ship have? Sails that is looking for the wind to take the ship forward. You also have a captain of this ship. You also have maybe some helpers, or I don't know what you call it, on the ship, and they're helping you guide the ship forward. Now, why am I talking about this? Because when it comes to coaching, what coaches do, life coaches, any type of professional who is putting themselves forward to you as a coach, coaching, life coaching, is all about taking your ship and looking at where you are right now in your life, what it is that you want to do, what it is that you want to achieve, where it is that you want to sail to, and is helping you to remove the obstacles. Maybe big waves, maybe some rocks, whatever it is that is in front of you, and how to overcome these obstacles in order to move to where you want to go. Okay, so coaching is all about the future, all about the now, what's going on with you right now, and about the future and what might get in the way for you to achieve the success in the future. All right, so I'm gonna write in big letters here, future. Now, another thing that we haven't talked about this ship is, as it's sitting in the water, it's sitting here, it's not going anywhere right now. So in order for the ship to sit in the water, it probably has some chains and an anchor that is holding it down to the ground, okay? Okay, so let's imagine that the ship has 3 anchors, and these anchors are stuck into the bottom of the sea, into the sand. And this is what is preventing the ship from moving forward. This is what is preventing the ship from getting lost in the sea, getting swayed by the storm of the future or of the now, and is keeping it in as a safe harbor right now. Right now, the ship is sitting in a safe harbor because it is attached by the anchors to the bottom of the ocean. All right? Now, life coaching is about moving the ship forward, okay? But the ship is being stuck to the bottom of the sea by these anchors. So this is where therapy enters. Psychotherapy, psychology, and psychiatry are all about assessing where your ship is right now with all of its givens, sails, team, illuminators, anchors, where it is right now and why it's there. What is keeping the ship from moving forward, okay? So it's looking at what are all of the contributing factors for the ship not to move forward, okay? So I'm gonna write it in big letters here, therapy. Okay, therapy is about the past and the now. Life coaching, as I said here, is about the future and the now. This is the starkest difference. This is basically the only difference. Life coaching is about where you are and what is preventing you from moving forward and how can you move forward. Therapy is about where you are now and how you got here. Why are the reasons, what are the reasons that you are standing here? How have you arrived at this harbor? Most of the time, therapy also considers the questions and is trying and attempting to answer questions about why can't you move forward and what is preventing you from moving forward. So coaching is answering all of these questions, but therapy is also addressing the questions of what is getting in the way, all right? So why don't we talk about now about all of the different techniques and the difference and the similarities about the techniques that are prevalent in both therapy and coaching realm, because sometimes they overlap, but there is a very, very important difference that can kind of create danger, okay, for a consumer of either of the field, depending on what you want to achieve and what you want to do. So listen carefully here. One of the very common and very, the most common therapeutic technique that you would find therapists, psychologists, and psychiatrists, social workers, and other licensed therapists help you with is something that is called CBT, or cognitive behavioral therapy. Okay, CBT stands for, as I said, cognitive behavioral therapy. It's dealing with what are you thinking, how are you acting in a daily life, and helping you through therapy overcome beliefs that are holding you back, okay, and behaviors that are holding you back. So if you think about this, thinking cognitive stuff that is holding you back and behavioral stuff that is holding you back is really dealing with the anchors, okay? These are all of the things that have to do with your past. These are all of your negative thinkings, limiting beliefs, all of the beliefs and all of the things that you hold in your body, in your mind, in your soul. I wouldn't say much of a soul, but in your habits that you're so used to exercising, that is keeping these anchors stuck into the ground. So CBT is actually about overcoming limiting beliefs. Okay. Let's talk about other types of therapy. We also have person-centered therapy. We have Gestalt, which is focusing on the here and now, where you're right here. And when you're looking at these kind of questions, you also get to uncover, well, what's holding you back. Person-centered is also about who you are as a person, and is looking also at all of the type of different team members that you might have on the team of the self that is contributing to where you are right now and how you have gotten here, right? So I could potentially list a whole bunch of other types of therapy, but basically the idea here is that therapy is mostly, okay, all therapeutic techniques mostly focus on the anchors, on what is holding you back. One of the common denominators of the things that are holding you back, of all of the anchors and the chains that are holding you to where you are, that are preventing you from moving to where you want to be, usually, most of the time, wake me up in the middle of the night and I will argue that. I'm gonna throw the number out there. I'm not gonna stand behind this because it might be different here now, but I would say that about 90% of the time, these anchors that are holding you back have something to do with trauma or adverse childhood incidents, or a number of adverse childhood incidents. Basically, trauma or complex trauma. What is trauma? Trauma is something that has happened to you, either needs that have been overmet by caretakers, or needs that haven't been met by your caretakers in the past, okay? So all of this is really dealing with trauma. Now, if you are at all familiar with trauma, if you have experienced trauma, and I would say that most of us have been, if you have memories from the childhood that you can't remember, if you have gaps in your childhood memories, if you actually do remember the trauma and there are thoughts that you don't like to think about, if they sometimes pop into your head and try not to think about them, if you are aware of some of the crappy things that happened to you in the childhood and you're just like, ugh, and you have this feeling of, ugh, I don't want to think about it, most likely you have experienced trauma, okay? As I said again, 90% of the time, people who are experiencing any kind of difficulties in freely moving forward in their lives have experienced some type of trauma. Okay? I'm going to take a deep breath right here. I'm going to ask you to take a really deep breath here, because whenever we're starting to look at the anchors that are holding our sailboat from moving forward, and whenever we're really talking about trauma, we really have to ask ourselves a question about how it manifests in our lives and how it actually shows up. When do we know that a trauma has been triggered? Trauma usually comes forward and expresses itself through a slew of very uncomfortable, heavy, in your face, strong physical sensation, emotions, and emoting. Okay? So we here have, for the sake of a easier word to use, we're going to call it trauma response. Okay? Okay, trauma response. We'll talk about all of this later, and this is for therapists to address what a trauma response is. But whenever a therapist is doing their job in helping you assess where you are, where you want to go, and why haven't you gotten there yet, and how you could potentially get there, they really are venturing into the space of trauma. And we are guaranteed to, at some point in time, trigger a trauma response in you. So the dangers of that is the fact that a trauma, whenever it irked at, you can get re-traumatized. You can remember some stuff that you haven't remembered before with specifically designed questions, and a licensed, educated professional is trained in helping you handle that response in the moment that it arises. Okay? So trauma response is usually a very strong emotion or a feeling or even an act. A lot of times an act can come through as an act of anger, okay? Or dismissal, like I don't want to talk about, there's a boundary that the response of like I don't want to talk about it comes forward, or an emotion, a very strong emotion, either tears or anger comes through. Okay, so traumatic response, as I said, we'll talk about it later, but there is a very, very big window of opportunity for therapy to trigger a trauma response. Okay, and this is what psychotherapists, psychologists, and psychiatrists are licensed have training in helping you with. Right? However, most of the time, whenever we have no idea about all of that happening, we don't know, we just know that we want to move forward. We want to like start some sort of a project. We want to start working out. There's some goal that we want to reach. We want to start a business. We want to change careers. We want to start a new relationship. We want something in our lives. So usually what we do, we end up coming to coaches to help us, give us a set of advice, ask us a set of questions that are helping ourselves to discover within ourselves what is it that we can do that we might not have been aware of in order to move forward in our lives. Okay, so here again we're talking about the future, where we are now and moving into the future. So what life coaches do, life coaches are asking you questions. A good life coach, trained, certified life coach, is geared towards asking you questions rather than giving you an advice. A coach should never be telling you what you should be doing. Okay? They can give you suggestions and asking you which one fit better, but a coach is never going to actually tell you do this. Neither would a therapist telling you what to do with your life or what decisions to make, other than what do you think we can do about this? What are some of the things that we have forgotten about this? Right? So they're evoking by asking you questions about what is it that we might not have seen in our blind spots. So does the coach, okay? So that's the similarity of it. So questions that a coach is usually asking you for about are they have something to do with what are some of the obstacles that you foresee for yourself? What are some of the obstacles that you have foreseen for yourself in the past that you have overcome, and how did you overcome that? What are some of when have you overcome these obstacles and what helped you? Okay, so coaches can potentially dip with a tiny little bit of a questioning into the past and ask you, when have you ever overcome something like this? And then use that success into helping you apply that skill into the future. But a coach is never supposed to really push their ideas on you or their beliefs or their systems or tell you do A, B, C, D, because that's not really healing. That's not really yours. That's not really owning your individuality and who you truly really are. So if we go back to the coaching and the difference between therapy and coaching, a lot of times I see coaching and coaches who like to use questioning that are kind of like 10 reasons why. Okay, so they like to use the question why. Why this? Why haven't you done this? Why didn't you do this before? Why haven't you wanted this before? What have you tried to do before? Why? The danger about asking the question why is the fact that it's opening up a subconscious mind. All right. If you think about this, question why is very open-minded question. Question why is all about dipping into your subconscious, because it's not a very pointed question. It's not really asking you directly who, what, where, and when. It's not pointed. It's very open-minded. It's very open question. So it's actually taking you into the place. And let me ask you this. Whenever somebody asks you, why'd you do that? Oh, why do you want that? Oh, why? What is the very, very first answer that usually pops into your mind as a response to that? And the answer usually is, I don't know. And then you think about it, right? First you say, I don't know, and then you think about it. So that is exactly the problem with the question why. It's too open-minded. It opens up too many doors that are way too overwhelming for the subconscious mind, especially the conscious minds, to process all of that. So why question if it doesn't bring out a defense mechanism of I don't know within us? And if the coach keeps prodding you with a why question, it usually ends up taking you to, you got it, here, the trauma. So let's look at the problem with that. All right, coach, a certified life coach, somebody who has had experience and education in coaching, most likely have not been trained in any psychotherapeutic modality. Most likely, they haven't been trained in how to handle your trauma, because questioning why will take you further and further and further into the past and will trigger one of the traumas that you probably 90% of the time, I would say, have experienced. Now, whenever the trauma is triggered, we end up experiencing a trauma response, which creates in a strong emotion or a feeling or an action. And usually, whenever a subconscious mind is not prepared to deal with a trauma, is not prepared to let out the trauma for the conscious mind to really deal with it, it goes into a closed off mode, and it says, I don't know, I'm not quite sure, and it starts repulsing the question itself. And at this point in time, there is a break that happens in between a relationship between a client and a coach. So what I want to suggest here is I want you to understand that life coaches who have some sort of certification or some sort of training in maybe a CBT modality, okay, as a standalone CBT modality, if they have that, great. If they have some sort of education, training in something along the lines of mindfulness. NLP is a big thing. Hypnosis. Okay, some of these things are evidence-based, some of these things aren't, but I don't fucking also give a shit, because I believe in whatever works, okay? And I've seen NLP, hypnosis, mindfulness work, and I've also seen CBT that doesn't work, okay? So it really depends on who you are and what really works for you. But I want you to be very mindful about what are these things that really geared towards, and what are the things that you could potentially expect to happen at the end of it, okay? So if a coach is experienced, has some sort of education in any of these things, along of some other therapeutic modalities that are geared towards at helping you handle trauma responses that may come up as a result of their questions, you're okay. Now, if you're dealing with a coach who doesn't have experience, who is solely relying on their life experience or the things I've done before and I can do this for you, or just a lot of stuff on the marketing things that you kind of see and you're like, oh yeah, they've done this, they can do this for me. Their trauma is not your trauma. Their experience is not fully your experience. I want you to be super, super mindful about who you're dealing with on a coaching realm. And I want you to also be mindful about who you're dealing with on a therapy realm, okay? Anytime you're working with anybody, I want you to ask for their certifications. I want you to ask for their education. I want you to ask for their testimonials. And also be kind of careful about testimonials, because psychotherapists, psychologists, and psychiatrists are actually not allowed to have testimonials because it's unethical, all right? Because every client's experience, every patient's experience is different. So again, to just recapture this, if I'm standing here, this is my boat and I want to move forward and I'm not quite sure, I'm keep hitting the rocks, I'm not sure what I'm doing, a coach would be a very, very good person to help you assess the environment. Is it sunny? Is it still? Is there a wind blowing? How hard is the wind blowing? How far do we want to go? Where's the nearest radio station that we can contact in case of a storm? Somebody who is going to look at the weather app and help you predict what the weather is going to be like in the future. Somebody is going to be like, hey, do you know what the obstacles are? Have you ever experienced them before? Have you ever overcome hard waves, or have you overcome rocks, or have you overcome sand dunes? Have you ever done this? Have you ever done this before? And if you haven't, if they have experience overcoming this, then this is something that they can suggest, some of the things that you can do if you ever meet these obstacles. So remember, coaching is all about where you are now and all of the obstacles that might be in your future about moving forward. And the thing that coaches ask are some of the questions that might potentially touch on the past, okay? But they are not in any way, unless they're certified in specific modalities, they're not supposed to be asking you questions and helping you overcome depression. They're not supposed to be helping you deal with mental health condition. They're not supposed to be treating you, okay? They're not supposed to be treating you in mental health condition. They're not supposed to be promising you to overcome anxiety. They're not supposed to be promising you to deal with narcissistic blah 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 personality disorder or narcissistic personality disorder partner, because they aren't trained in these mental health conditions. And if they are, great. And if they aren't, run, okay? Run. So let's look at the types of therapists that you could potentially look for to help you deal in those areas that coaches aren't trained in. You are looking at therapists. Therapists are trained and licensed to specifically help you treat a mental health condition or treat any obstacle that you might have in your life, but it is specifically having something to do with the past, okay? You also have psychologists. Psychologists are somebody who is doing the same thing as a therapist, plus they are allowed to assess mental health condition and give you a diagnosis. They can diagnose you, okay? Then we have psychiatrists. Psychiatrists can also treat mental health conditions. They can also help navigate the future, navigate the now, and give you skills and tools and how to do all of that. They can also diagnose, assess and diagnose, of course, obviously. And because they're medical doctors, they can prescribe medication, okay? So these are the biggest difference. Right along with therapists here, I would also like to put social workers. Okay, social workers, registered social workers are allowed to treat mental health conditions if they're specifically trained in that, but they're also supposed to put you into touch with social resources, and they can give you an advice, they can advise books, they can refer you to proper coaches, psychotherapists, psychiatrists. So not all social workers are trained in psychotherapy. A lot of them are. So you can get psychotherapy from therapists, social workers, psychologists, and psychiatrists. Some social workers can give you therapy. Psychologists can give you psychotherapy and diagnosis. Psychiatrists can give you psychotherapy, diagnosis, and medication. All right? Life coaches can do either of them. Life coaches are not allowed to treat mental health condition. In fact, it is unethical and illegal for life coaches to refer and speak about and even talk in their marketing or anything about relieving or treating anything that has anything to do with a medical, psychological condition that appears in this book. DSM. Diagnostic and Statistical Manual of Mental Disorders. If a mental health condition appears in here, life coaches are not allowed to ethically speak, treat, talk about treating it at all, okay? It's the job of a therapist. So if you have a coach, or if you're finding yourself looking at a coach or looking to hire a coach who's telling you that they can help you deal with depression, they can help you deal with anxiety, well, can help you deal with panic, will help you deal with burnout, can you help you deal with narcissism, or help you deal with narcissism, it's in here. Okay, and I don't subscribe to this book. I'm not like very diagnostic myself, but the reason why I'm driving this point forward is because I want you to be super aware of what a life coach can and cannot do. And I want you to understand the difference in between the two. And I want you to also understand where it all meets. Both life coaches and therapists deal with the now. Where are you right now? How are you dealing with the right now? It's in the here and now that both of these professions meet. Okay, so let's keep our eyes open, our mind open, our hearts open. Let's stay aware. Let's look and hear and see the difference, and ask for education, ask for experience. Ask for testimonials. Ask for years in practice. Don't just buy shit online. Guys, don't be the perfect target market. Okay? I hope this helps. And I will see you in another video. Don't forget to subscribe and press that little bell button if you're on YouTube, or click a link in bio if you're on Instagram, IGTV. I'm here. Ask me any questions. Love you.